the Toronto Star, I'm Saba Itazaz, and this matters. Through wave after wave of COVID-19, we saw ICUs filling up with workers who faced an impossible choice between their own life and keeping food on the table. Most chose the second. Most had the kind of job where you punch a clock until the clock ran out on them. We all remember the haunting posts on social media, doctors across the province sharing stories of their patients who caught COVID-19 at work and fell seriously ill or spread it to their families. They kept pleading for a safety net in the form of paid sick days. The Ontario government implemented one this summer after a lot of pressure. A temporary 3-day paid sick leave program that's now being extended till the summer of 2022. Nurses, doctors, and healthcare providers say it's not enough. They've been organizing rallies and protests to advocate for a better paid sick leave program. The federal government has responded to these growing calls and evidence by introducing Bill C-3 with 10 days of permanent sick leave as a minimum standard. Meanwhile, Ontario most recently voted down an NDP-proposed Bill 8 that would have introduced 10 permanent paid sick days and 14 additional ones during public health crises. That would make it 27 times paid sick days have been voted down in this province. As the Omicron wave rises, are those who need protection the most any more protected than when we started? And why are doctors being forced to fight on two front lines, the virus and the system that exposes people to it? Dr. Gaibrie Stephen, an ER physician from Peel and a member of the Decent Work and Health Network, joins me now to make his case. Hi, Gaibrie. Thanks so much for joining me on the podcast today.
Thank you so much for having me.
So, over the course of this pandemic and the systemic failures that we've seen that it's highlighted, have you seen that the role of healthcare workers has sort of shifted and expanded beyond just patient care?
Yeah, it's an interesting question. So I think what we have seen is a lot more healthcare workers speak up on systemic issues in the media for the wider public to see. But I actually don't think that the role of doctors specifically have changed considerably. So in the Royal College, there is a identified framework for physicians called the CAN-MEDS framework. And so this is basically the facets of what makes a physician an effective physician. It's what we consider part of the job and what we're trained to do. And in fact, health advocacy is actually enshrined as one of the roles of a physician. And it's actually part of doing the job. So advocacy has always occurred at the individual level. So for a long time, physicians were there to advocate for patients on the individual level. And we continue to do that every day we go into work. But a big part of advocacy is also some of these more meso-level advocacies or larger systemic advocacy initiatives. Physicians have been at the forefront on many of these in the past around vaccine campaigns. Physicians have been in the forefront, for example, around legislation around gun laws here in Canada. I think that this pandemic has certainly made a lot of physicians who may have been less comfortable with systemic advocacy come forward who previously may not have. And I think that the physician face in the media has definitely changed as the public really geared into looking for their advice when it came to the COVID-19 pandemic.
Like you mentioned, the last 2 years has taken such a heavy toll on all of us, but especially for frontline healthcare workers. You're fighting COVID-19, but at the same time, we saw healthcare workers fighting for vaccine equity and for paid sick days. Did it feel like taking on a lot at the time? Did you feel like you had no choice but to do that?
So there was a time in this pandemic where it felt like doing systemic advocacy was really the only thing that kept me going. I think there's a lot of compassion fatigue that a lot of healthcare providers experience during the pandemic, me included. It's very difficult and disheartening to come to work and see the end outcomes of a lot of, frankly, systemic inequities. ER physicians, which is what I do, are used to this. I mean, the ER is often the last place that people arrive when they have fallen through every crack in our system and are facing bad health outcomes as a result. I recall in the middle of the third wave in April, which was so devastating, I remember we were seeing surge numbers of COVID-19 in hospitals across the GTA. We were having ICU beds, slim pickings. I remember people were being transferred to facilities in neighboring cities that were hundreds of kilometers away. In some emergency departments, I know that people were waiting in ER beds for up to 3.5 days on average because there was just no space to move people. And so we were seeing these big backlogs, but at the same time, schools were open. There was wide vaccine inequity, especially in regions where I work, like in Peel. And we continued to have barriers like a lack of paid sick leave, which was a huge issue for my patients. I remember at the time, this led to over 200 physicians, ER physicians across Ontario coming together. And we wrote an open letter, for example, to our government leaders urging for urgent assessment of these systemic barriers to people. I think these are the kind of things that really made work a bit more palatable for me during those times. And being able to use the voice of healthcare workers to carry patient narratives has been really meaningful. I mean, we're going to talk about labor issues specifically, and it's really sad because we rarely get to hear directly from precarious workers, mostly because they have a lot of fear of work repercussions. I mean, these are my patients, and I hear these narratives frequently at work. Unfortunately, I sometimes end up being the messenger of some of these tragic stories. I wish we lived in a world where precarious workers had the means and the safety to speak out about their negative experiences, but that is unfortunately not always the case. So I feel like there is sometimes a moral imperative for me to speak on these systemic issues.
I think that's a very important point. And I will want to talk about some of the interactions you've had with those workers who've been affected as well later on. Let's come to a long-standing issue. I think it's not just COVID-19 related, but the issue of paid sick days. First of all, what's your current take on Ontario's current paid sick leave program? Why are healthcare workers saying so adamantly that this is not adequate?
Yeah, so for your listeners, I think I want to just highlight what the program we're talking about is in some more specific detail. The program we're referring to is the WIPB program, which was introduced by the Ontario government. I think that there's a real mischaracterization of what this program actually is that has been happening both from government leaders, but also in the wider narrative of how it's framed. I want to be very specific that this is not a comprehensive paid sick days program. This is an infectious disease leave program. The WIPB, to be specific about it, the people who are eligible for WIPB are people who are in some way affected by COVID-19 specifically. Whether it be they have COVID-19, they need to get tested for COVID-19, or they have a need for vaccination for COVID-19, or for example, they have a mental health issue related to COVID-19. Everything is related to COVID-19. So that's the one issue. This is not a comprehensive paid sick days program. The other issue here is that people who have access to this are eligible for up to 3 days by their employer. The way it works is the employer will pay up to 200 days of your wage for that day, and the employer is then reimbursed by WSIB for covering you for up to 3 days. So there's a few issues here. One is that it's only 3 days of coverage. We know from other studies and from other jurisdictions that effective paid sick days program, really we look at least 10 days. Practically speaking, if someone had the flu, for example, and that were to happen, I usually tell people to stay home for at least 48 to 72 hours. So that means one flu means that they've used up their entire paid sick days initiative as per our current WIPB program. When we're talking about a wide-scale pandemic on a year basis, we need much more paid sick days than that for it to be actually effective. So I think the way that WIPB has been characterized is misleading. And then on top of that, we have to recognize that this program is set to end at the end of this year. This is not a permanent program. And we know that COVID-19 is not going to end this year. And I frankly am concerned. Maybe we're going to extend WIPB. But here's the thing. Many people, many precarious workers have already used WIPB and the 3 sick days. So what are they left with as we head into the winter months? So I think these are the issues I have with this program. And it's, I think, a bit more detail about what it actually is in specifics.
That's really helpful. And like you mentioned, it's not a comprehensive program. It's COVID-19 related. But even when it comes to COVID-19, the usual time for isolation is like 10 days to 2 weeks, right? And this is only giving a one-time option of 3 days. So even on that front, there are some gaps here.
Absolutely. Absolutely.
What's needed in its stead, in your opinion, and what advocates are saying?
Yeah. So there was a great bill that was tabled recently, which I think we may talk about, which was Bill 8. And this was the Stay Home If You're Sick Act. This bill did have many of the characteristics which we are looking for. So, as advocates, what we're asking for is paid sick days that are seamlessly accessible. This means that workers don't have to do applications for paid sick days. Workers don't have to go and get sick notes in order to access paid sick days. We know that these barriers mean that people are less likely to actually access this because what we need is for on the drop of the dime, tomorrow I have a sore throat, I can call in sick to work and know that I won't be going under financially. So seamlessness is very, very important. We need something that is permanent because paid sick days is not just a pandemic specific issue. I've been worried about paid sick days long before the pandemic, and so have many other healthcare providers. Paid sick days needs to be an essential work right. And so permanence is very, very important. And then the last other one that's really important is adequate paid sick days. So what we're looking for is paid sick days that are adequate, which means at least 10 days of paid sick days. We look to other jurisdictions to see where paid sick days have been implemented. We know that New Zealand has moved to 10 paid sick days. Ireland will be starting 10 paid sick days. We know, for example, that many jurisdictions in the United States have paid sick days that are far more robust than anything that we have here in Canada. And so I think looking to other jurisdictions is very important. This is not an impossible thing to do, really just a fundamental work right.
We'll be right back. There's definitely many examples of how other jurisdictions have implemented this successfully, and definitely Ontario is not the ideal example for how we treat paid sick days. You brought up Bill 8, so I'm going to come to that because that was voted down. What does it say to you that we're almost 2 years into this pandemic and you're talking about how other jurisdictions are managing this, but we're still debating it? And Bill 8 was probably just one of the 27 times that this has been voted down. And as someone who, as you say, you're seeing the direct effects of this in your ER, what does that say to you? What does that make you feel about the kind of system that we have?
Yeah, it tells me that our system and our community doesn't care about the health of workers like we think we do. It means that we are willing to put the health of workers on the line for our benefit without actually rewarding workers the way that we think that we do. I think paid sick days is a moral issue, in my view. It's a fundamental work right. I can put this into a narrative. This is what I see. I mean, I had a patient not too long ago, and it made me really angry. This was someone who works 80 hours per week in 2 minimum wage jobs. This is not an uncommon occurrence in this province. Because the reality is, working 1 minimum wage job earns you, after tax, just over about $25,000 a year. Imagine living on $25,000 a year in any city in this province. They work 2 jobs and they earn just over $50,000 per year. They saw me in the emergency department because of a number of issues that were chronic musculoskeletal problems that were likely related to repetitive strain and working 80 hours a week. Nobody can tell me that working 80 hours a week is healthy. Now, consider that this hard worker doesn't have a single day of access to any real paid sick days. WIPB aside, this means that they're taking time off to just tend to any of these injuries that they've sustained, means that they may not make ends meet. They told me that I can't take time off. What can I do? I need to work. How is anyone expected to live like this? And this is many workers. And the reality is there are many workers in this province that are barely staying afloat with their head above water. And illnesses can be the thing that drowns them financially. We know that precarious work makes many people sick. And then we're not providing people the means to even recover from that. And so when we're talking about voting down Bill 8, what we're doing is we're putting the interests of employers, whatever they may be, over that of workers. And this has been a trend I've seen when we talk about paid sick days. You know, things like people will abuse paid sick days or, quote, it will cost too much for businesses. These are the arguments that are being put forward when we're voting down paid sick days. And frankly, a little part of me dies every time I have to make an economic argument for moral issues like paid sick days. But let me say this. Let's look to other countries who have implemented paid sick days. It is a policy that makes sense and it is cost effective. Sick workers means less productivity. It means potential outbreaks in the workplace through something called presenteeism, meaning coming to work even though you're sick. In San Francisco, paid sick days have been a reality since 2007. San Francisco has had up to 9 paid sick days for workers since 2007. And they have had studies. A survey of over more than 700 employers and nearly 1,200 employees found that the paid sick leave program benefited employees without any impact on employer profitability. Here we have in Ontario the Better Way Alliance, which is a group of small businesses that are actually calling for paid sick days because we recognize that it is actually good for businesses to have paid sick days because it means that it is cost effective. I mean, it's unfortunate that I have to make these arguments about economic impacts when right in front of me, I see workers that are fundamentally barely surviving because of a lack of paid sick days. But that's just the world that we live in, I suppose. But it makes me angry. I think you can hear it in my voice to see this bill voted down and then seeing what I see.
Interacting with these patients who, like you said, had to face a choice between their health and putting food on the table, when we're talking about that kind of worker, we're talking about a certain demographic, the most marginalized, like newcomers, racialized people. And I guess it speaks to how the system treats them as well. Is this one of the reasons why many doctors were kind of forced to share the painful stories of the patients that were coming in? It's not something doctors typically do.
Yeah, absolutely. I think narrative is a tricky thing. I mean, we have to be very careful with narrative, but narrative is something that allows people to sort of understand experiences. When we use narrative, it's important that we're both mindful about patient confidentiality. We're mindful about making sure that people are not identifiable. And I think these are all important characteristics when narratives are shared. But narratives do have a role in terms of understanding issues. We can talk about paid sick days from statistics, and I can give you so many statistics about paid sick days. But I think for a person who doesn't directly feel the impact of what these bad policies have on their health, I think hearing the narrative of people is important. And when we talk about paid sick days specifically, we are again talking about, like you said, the most precarious workers in our community. Workers who speaking up about these issues might mean that they are unable to work anymore. We're talking about people that are held back about speaking up because, for example, their immigration status may be on the line. We're talking about temporary agency workers who may not speak up because it might mean they may never get called back into work and employment. And so these are the types of individuals that we are seeing who are most impacted by these policies. And they are not a small margin of our society. They are people that you interact with every single day. They are the people that are essential workers that are putting food on the table. They are the ones that are manufacturing some of the appliances and equipment that we use every single day. They are our gig workers, our digital economy gig workers that are delivering food to our doorstep every single day. And these are the narratives that are missed. And these are the narratives that, in some ways, I try to bring forward for people to understand.
Yeah, I mean, we're talking about people who kept things going for us while many of us had the privilege to stay home. Can you talk to me about some of the things that stayed with you from working during the peak waves of this pandemic?
So I think the most vivid moments for me have been moments where I felt disconnect between what I'm seeing and the policies that are being implemented. I think the most vivid memory I have is probably working in April. April of this year was this very, very tough. We were really seeing a big surge when it comes to a lack of paid sick days and the impact on temporary workers as well as precarious workers as we moved into wave 3 of this pandemic. And I recall, seeing these cases time and time again, the wait times for ICU beds becoming more challenging and more real for patients. And then I remember watching a press conference and seeing our premier characterize paid sick days as a disingenuous policy. I remember watching a press conference where our premier accused supporters of the policy of playing politics. And I remember really having a feeling of just being not heard, a feeling of this disconnect that was really happening from administrators and policy persons to what's actually happening in the front lines, which is where I work. As health workers working in the front lines of COVID-19, we've seen essential workers die due to a lack of provincially mandated paid sick days. And this is why we continue to advocate for policies which protect people from unnecessary suffering and death. No one should have to die because they had to go to work in order to pay the bills.
So essentially, in a way, you're also saying that paid sick days early on could have saved some precious lives.
I truly believe so. And to back that up, I mean, we do have data on paid sick days in pandemics. So in 2009, an H1N1 survey in the United States found that 1/4 of people wouldn't get paid if they stayed home when they were sick, and 1/6 of people said that they would lose their jobs. Of this people, we know that when it came to the H1N1 pandemic, people not staying home could have caused an additional 7 million additional cases of H1N1 in that pandemic and over 1,300 deaths because of workplace outbreaks related to H1N1. We know that in jurisdictions in the United States, like San Francisco and New York, implementation of paid sick days saw a 40% reduction in influenza rates during flu waves compared to when paid sick days were not implemented. The reality is we have data in pandemic situations and in endemic situations where paid sick days does prevent infectious disease spread. So absolutely, I think paid sick days could have saved lives if we had implemented this sooner. But I think the reality is we've recently marked, I think it was 10,000 deaths related to the COVID-19 pandemic. And I do continuously think back to those deaths. And I think back and say, how many of these could have been prevented had we acted on this sooner? But looking forward, I think there is still time. COVID-19 has not gone away. The reality is there is still time before the winter season to implement paid sick days so that we can prevent more unnecessary deaths.
There is still time. That's a really important thing to end this on. Thank you so much for your time, for your insight, and for sharing some of your experiences with us, Gaibrie.
Thank you so much for having me.
I was talking to Dr. Gaibrie Stephen, an ER physician from the Peel region and a member of the Decent Work and Health Network. That's it for today. Thanks so much for listening. I'm your host, Sabai Tazaz. The This Matters team is Brian Bradley, JP Fozo, Matt Hearn, Morgan Bucknick, Raju Mudhar, and Sean Pattenton. Our music is by So-Called, Mike DeAngelis, and Sean Pattenton. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com/subscribingmatters. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.